Medical disclaimer. Please note that the information shared on this podcast is for educational and informational purposes only and should not be considered medical advice. Always consult with your healthcare provider before making any changes to your health regimen, including starting new therapies, supplements, or treatments. While we discuss cutting-edge research and advancements in cellular medicine, individual health needs vary, and professional guidance is essential. By listening to this podcast, you acknowledge that neither Dr. Seeds nor the podcast team is providing personalized medical recommendations.
On today's episode of Redox Revolution, we're going to talk about how important your relationship is with your dentist. Welcome back to another episode of Redox Revolution with Matt and Maddie. Guys, great to be here with you. Where are we going today?
Tell us, Matt.
Because I'm ready. Hit me with anything. Let's do it.
Okay.
Let's make it happen.
Cool. You watch any good movies lately?
Yes.
What?
I think it's probably one of the best movies of its time.
Whoa.
It has so many touch points and how it just can just really capture your attention, your emotions.
You're just incapable of giving a short answer, aren't you?
Frozen.
Ooh.
Yes, I had my first experience with Frozen flying to Barcelona, right? Yeah, I'm like, oh my gosh, this movie is so awesome.
We've been
What
trying
about
to
it?
watch it for a year, so finally got to see it.
Well, because every time you're on an airplane, you just watch Jason Statham's The Beekeeper, which...
No, or I watched the airplane mode of what countries we're traveling through, what airspeed, and...
Flight Tracker.
Flight Tracker,
You
yeah.
watch Flight Tracker.
Which is amazing. Or I watch other people's movies across what they're looking at, and I just...
Loves to watch
You're a
everyone
screen
else's
peeker.
TV.
I'm a screen peeper, and I don't like the words. I just like to put it together in my own mind what the movie's saying, and they're really good.
And he's really not sly about it. Like, if he's sitting here, he'll be staring across the aisle at the TV and then let out subtle laughs and stuff.
You know, in college and like right after college, I really thought something of myself because I'd watch these super in-depth, super intellectual movies, right? That just challenged your mind and made you think. And then I'd go home and here's Dad watching Fast and Furious 5 or some other like Aquaman's and some other Jason Statham movie or some movie where The Rock is flexing through a cast. And I would think to myself, I'm like, you're the smartest man I know. Why do you love all these dumbass movies? And then it wasn't until we started working together and by the end of the day, my brain is mush that
You're like, I just went dumb.
I'm like, I just want to sit here and I don't want to use my brain. And I see the Fast and Furious come on and I'm like, yes.
Thank you.
Sometimes mindless TV is the best TV, but now you'll see him watching Frozen.
Which is just, I can't say enough about Frozen, and the singing is it's special. I mean, the whole thing is.
I remember what you said at Mastermind, and I want you to repeat it here. What'd you think of, what's his name?
Prince Hans.
Yeah, what do you think of Prince Hans?
What a dick. Prince Hans had me fooled. Thought here's a stud, here's a guy looking out for the girls, and here's somebody you're supposed to depend on, and that guy was such a slime ball.
He saw it live in Disney before he saw the movie. So he was very confused why everyone was booing when he came out. He's like, he looks like a nice guy. Like, I don't get it.
Interesting.
The movie made it make sense.
Movie put it all together for me. It was fabulous. Yeah, I had a redox moment.
Interesting. Well, today's topic has absolutely nothing to do with any of that stuff.
Well, thanks for asking
but
questions.
You know what?
Yeah.
A preamble is nice sometimes, right?
Yeah.
Today, we're going to talk about bad breath.
Ooh, we should have done this when he went to the dentist.
Well, specifically
Sorry, I had good breath and I had good hygiene, so I don't fit in that category of...
Except for all those years when you were making your amino drink. That was brutal sometimes. That was brutal. Oh, man, in the kitchen, he'd be testing all his new. He tweaked the amino drink for like a decade, right? Just
you're
testing
like a
little.
scientist.
It was like his lab down there, making little micro adjustments to it for his hydration drink, and every time when he would really start chugging it was right before and then during our workout. He'd bring it out to the gym, and me as like I probably weighed like 160 pounds soaking wet, having to spot him doing bench. And I'm standing over him while he's huffing and puffing. He's blowing air into my nose. It was almost like there was just a straw straight from his mouth into my nostrils. It was so fucking bad. And so I got to smell 10 years of the amino drink.
Ooh.
Yeah.
Interesting.
That's why I feel like I have some
You can't
IP
drink the
claim
amino
to it.
drink.
Like I was literally the lab rat, but just from
For the breath.
none of the benefits, all of the exposure. Anyway,
He was probably smelling the catabolism right there and there, then and there of certain proteins. That
There's the signs of what you were smelling.
well, and we're going to talk about the science of
we could talk about
bad
how much I
breaths.
was benching then, but we won't mention
no,
that.
because when you talk about how much you bench, you forget where you are in a conversation. So
Yeah, we're going to talk about how bad breath, its connections to your overall health. So, according
This is a good
to
topic.
the American Dental Society, which neither me or my father even knew existed before a couple weeks ago, roughly.
Yes, we did.
Huh?
Yes, we did.
I know. I'm just making a joke about how we never go to the dentist.
Yes, we do.
Do we?
Kind of.
Roughly half of adults have experienced bad breath in their lives. Starting off, is bad breath transitory or is it systemic?
ooh.
Well, let's start off by saying I can't emphasize enough how we talk about primary care and we talk about how important healthcare is. Maybe by the end of this discussion, we'll really emphasize how important dental care is to this whole redox aspect of life and disease. And because
Yeah, and anytime I'm bringing up the fact that we don't go, I'm calling myself a dumbass. I'm not making a joke of the dental profession, to be very clear.
No, it's an underutilized resource that we do not realize now until, I mean, maybe I can help and maybe we need to push this more on we talk about the microbiome in the gut. Well, there's the microbiome in the mouth and that's the gatekeeper. That's where it starts. And believe we'll get into this, I guess, that the microbiome and the dysbiosis and the redox changes that occur and the immune aspects that change in the mouth have profound systemic effects on the heart, the neurological system, muscle, plaque buildup, you name it. I mean, we could relate this, and we should, and it's why it's so important to understand what goes wrong, and I'm hoping we get into that part of why this is so important because I don't think this is something we can control, and we can absolutely change to our benefit that can have a profound influence on our lives, and again, people do not understand that. So let's talk about this. You said halitosis?
I did not, but you can go ahead and
What?
dive into
Oh
that.
my gosh. We said bad breath and I thought, halitosis.
Is that what bad breath is called?
That's what we call, that's more of a medical way of looking at something that's just not an odor that comes out of your mouth that's just not acceptable,
That's
right?
a really nice way to put it. It sounds beautiful. Oh, they have halitosis.
Halitosis.
That could be a nice compliment, like you're sitting next to someone on the
Yeah.
airplane and be like, wow, you have a great halitosis. And they'll think you're
They'll
just
be
risen
flattered.
them up. But yeah.
Well, so that halitosis or this transient change in breath, transient's more like food, like onions, garlic, things
Love garlic.
things that can create hydrogen sulfide in a way that's a more physiologic thing that happens for a short period of time. It's just it's a response from the breakdown, and it's the chronic. That's not the transient that are the bad breath that comes from it comes from an acidic environment in the mouth, a redox change. It comes from protein catabolism of creating these hydrogen sulfides and these methyl sulfides that are all very pungent. And it's related to a dysbiosis of a dysregulation of the microbiome, loss of redox, and an immune dysregulation in the mouth. And that's it. I mean, we took something that we see in the gut that happens absolutely in the mouth, and that's what creates that bad breath.
And the mouth goes to the gut.
Well, what's interesting by saying that the mouth goes to the gut, if you create this dysbiosis in the mouth, and you create these bugs that are bad players, which are they're anaerobic gram-negative, just like in the gut. Well, you can swallow those into your gut, and they can multiply. I mean, that's how you can also aspirate them into the lungs. If you're having dysbiosis in the gums, which is where it happens, and we can.
So is this a precursor to gum disease? Is what you're saying?
Yeah. So that's perfect. But so I'll finish up with, if you have this gum disease, and we'll talk about how that happens, because I think people should realize that leads to, remember how we talk about breakdown of the cell, loss of that protein, those tight junctions that keep cells tight. Well, same thing happens in the epithelial cells of the gums, and you get LPSs and toxins that leak into the blood system, and there you go. You've got that immune dysregulation that starts, and it's a whole process, all starting with plaque formation. Consider plaque like a biofilm that builds up to create more of an acidic environment and a lower pH acidic environment. It's related to lower saliva production, where all of a sudden that changes the environment for more anaerobic gram-negative bugs to survive because of the acidic environment, and less oxygen getting there because it's forming this biofilm. And you get these, when your doctor checks for pockets, those pockets are the gum, between the gum and the tooth, and then you get the plaque over top of it. That's like the biofilm, and you build these pockets of really where the anaerobes gather and grow. Ooh. And those create what? The endotoxins. They create then that inflammatory. They create the loss of redox in the epithelial cell because of the inflammation from the immune system that's gone crazy because of this plaque. Wow, right? And that's why it's so important to control. That's why you go in for your cleaning, to get this plaque well controlled and to make sure that you do your brushing, but also you got to do your flossing.
That's what I was going to ask. Is the flossing to keep those is that like getting the pockets?
Yeah, it's keeping that biofilm from building, and that plaque. It's you're controlling. Eventually, you're controlling the microbiome of your mouth. You're controlling redox. You're controlling the fate of where all of that process goes, and that's really it's kind of profound if you think about looking at diseases, neuroinflammation, atherosclerosis, insulin resistance. Mm-hmm. We can relate that to specific bugs and their endotoxins they produce, but also how they affect the redox and the immune system, how they lead to these disease states.
Wow.
Yeah, it's fascinating, and it's why oral hygiene is huge. And you're not. Here's another place. You're not going to win if you realize that somebody has significant periodontal disease, you got to get them to the dentist. They've got to start getting into that process of working on plaque control, biofilms, doing their best to control redox.
What about like root canals?
Well, that's an end result of, if inflammation gets. So that's where those are the stages of what lead to those problems, potentially, of where these, the inflammation created by, these anaerobes that create this dysbiosis create the redox changes in the epithelium that are influenced also by the immune cells that are reactive in this area because of this change in the microbiome and the LPSs and the redox changes that then trigger these immune cells to produce these cytokines and chemokines and reactive oxygen species that start destroying tissue. They start destroying the gums and the tissue. And this is where you get into these issues of lipid peroxidation. Mm-hmm. And then this, you get more iron that's free. And these bad bugs want iron. It's how they keep surviving. And then they release more of these cytokines like rankle, which is something that it's an osteoclast cytokine that breaks down bone. And that's what starts leading to the breakdown of bone and bone infection. It's a combination of redox, immune, breakdown of and microbiome, dysbiosis. It's those three together that create, and then nerve inflammation because of the redox changes in the cells, and the potential of infection makes that even worse.
Aren't root canals pretty controversial?
That's what
It depends.
Because there's what is it, the Chinese heritage where they connect the root canal to breast cancer, the root canal to gut issues, if you've had that.
Which I think goes to what we just discussed. It's what's the instigator that leads to that? Mm-hmm. Well, it's a much more profound problem because most of those people that have those issues have the dysbiosis, redox loss, and immune dysregulation. So we just called it out. It's related to that, but it's a much. We got to the root cause.
That's what. Good play on words there.
What about some of the other hidden culprits like dehydration or ketosis or even some medications?
The other, what did you say? What'd you call them?
Like hidden culprits of bad breath.
Well,
ketosis is nice breath. You smell fruity.
Mm-hmm. Yeah, I think it's all context dependent. So going back to, you said low saliva?
Dehydration.
Yeah. Well, dehydration is what leads to low saliva. Saliva you need. Saliva increases pH. It improves acidity. It also has something in it called lactoferrin. And lactoferrin is actually what controls it. It takes up that iron that those bad bugs want. So it controls diversity. It controls immunity. It's an antimicrobial also that you naturally produce. So if you have lower saliva, you're setting up this problem for increased acidity, increased protein catabolism, increases in iron for these bad bugs to utilize, and you're losing that natural antimicrobial that you have, lactoferrin, that you need in that saliva. So saliva plays a big role, and that's all secondary to hydration. That's another emphasis as you get older on why we talk about this hydration drink, and why hydration it's not only important for the cell to maximize its redox, but it's important here in the first barrier and first microbiome affected for those reasons I discussed. And so it's a big thing.
And it doesn't give you bad breath anymore. You figured that out. Good work.
Well, you just can't have somebody lifting over top of you. You got to pick the right amino acids. We've got to it eventually. That was correct.
I know this isn't necessarily related to the topic at hand, but saliva's awesome. Anytime I ever cut my hand or cut my fingers, let's say I put a pretty good gash on my thumb.
You spit in it?
Oh, I'm just sucking on it with my mouth for 10 minutes until it starts to stop bleeding, essentially.
That doesn't seem kosher to avoid an infection.
It's it goes back to that thing about why dogs lick their injuries and how saliva has...
it's my own saliva. It's part of my own defense system.
Yeah, there are defenses in it that actually are... And lactoferrin is one of those big things. And in fact, I don't think enough emphasis is placed on if you have this disease process and you're improving it with your brushing, you're improving it with your with gum disease, with using flossing or water picks or whatever, supplementation with lactoferrin and lactoperoxidases has been shown to improve the microbiome of the mouth, improve improve the environment for improved periodontal disease. I mean, it's proven. So that's something I don't think we pay enough attention to, where lactoferrin can be a really effective, 20 milligrams a day.
Pivoting a little bit, what about, or did you have a question?
I was just going to make a statement. I don't know if anyone else does, but I really struggle with the water pick. I end up with more water everywhere besides my mouth, and I don't know why.
Interestingly, I use this device. It's a Proclaim. It's called Proclaim or something. It's a device that's molded that I put in my mouth, and it's a molded a mold that generates water through the mold that does the picks.
Oh, that's what I would need.
Yeah, it does it at certain speeds, and I think that's why I've been able to do a good job with my.
That's what I need.
Share your secrets. Where do you get this? What is this?
Because my water goes everywhere.
I don't know if I said the word right.
We understand what you're saying.
It's a mold that you have to have a.
We understand how a mold works.
Make it.
Yes.
And it takes a little while for them to build it. I think they could do it without a mold. I think it's a ploy to get it. But anyways, it's still, the concept is great because
it keeps you honest.
It keeps you honest, and it does a really good job of different intensities that it uses.
I would use it.
And
so would I.
And you can use it in the morning.
You've sold it. You're over explaining it. Where do you get this? The dentist?
Yeah, you got to ask your dentist, or
I'll look on Amazon later.
I think you can look, and they'll direct you to a dentist that can do the molds for you. It's a little bit of a, hey, look, I'm going to call it out. It's a little bit of a scam because you need to get a dentist involved. You're going to go in and see the dentist. Dentist's going to tell you need to clean your teeth, all this stuff.
Which is probably true.
But it's probably true. Okay, that's the bottom line. The dentist, it's all a good thing, but you kind of feel like it's a little bit of manipulation because they're making a mold for you. This mold is you don't need them. I'm telling you, you could do this pretty well without it, but it is a little bit more accurate. I'm not saying it isn't.
Yeah, I was about to kind of push back on what you're saying because I haven't been to the dentist in 6 years. But I think it's moving.
Look, I'm an idiot. I think you need to. I think it's a smart thing to do because you don't realize how important your dentist is. You don't realize how important this healthcare. I think you need to get your teeth cleaned every 3 to 4 months. You need to.
I thought you were going to say every 2-3 years. I'm like, oh, I'm doing great.
No. You need to be on this because you can control your health and your redox that we talk about. I think we can trace so much back to the mouth that we're not really educating people enough about.
If it gets me to use it, I don't care if it's a little bit of a scam or a little bit of expensive. Mm-hmm. You know what? Because I don't floss enough. I don't use the water pick enough. And if this thing is that simple where you can just plug it, play it, done, cool.
It's not a scam. It's a smart thing. It's a great
See,
way
I'm
to
so
get
happy
you to
I
the
brought up my
dentist.
struggles.
The dentist isn't there to trick you and tell you, oh, you need a cleaning, because they're right. They get you there. They see you and they're like, okay, you're a disaster. You're here. Look, we can get you set up. They're trying to help you. So I think it's an awesome way to get involved in your healthcare.
I'm going to ask you about this, where you got it. I want to see the brand name. I want to get one.
It's called, I think it's called Proclaim, I believe, and you can look online. And
I'll find it.
And
I'm gonna look.
they'll direct you.
Send me one.
They'll
Too.
direct you
will.
to a dentist that does the mold. Not all the dentists do them. Like when I went to get this tooth problem I had, and I you know, they were talking about how my hygiene looked pretty good. And I was doing like, what do you do? And I said, oh, I use this Proclaim, and they're like, well, what's that? You know, like I don't think everybody knows what it is.
Yeah.
But any kind of, I think, directed high intensity water picking is excellent, right, for the gums to work on doing something that it's hard to do.
Did they fit you for your mouth guard for lifting while you were there too?
No.
Max, you looking it up?
Should have done it.
Proclaim. Yeah, it looks like exactly what he's saying. You get a mold, and it's like a device that you put in your teeth and it shoots water all around it.
Awesome. I want one.
How much
I
is
would use that.
Max, how much is it?
Can-
It was
This says learn more.
it was
so
kind of expensive, but it's been worth every
You
penny.
know when they say learn more, it's expensive.
It is, but it's worth every penny. It
For
just
sure.
sucks because it takes a while, because you have to go see the dentist, got to get the mold, they got to send it away, then it's sent to you.
I haven't looked right. There's probably something on Amazon that doesn't have a mold.
bet you there is.
Probably a lot cheaper.
I'll be doing that after.
I think you could do
buy
that.
2 of them.
Got it.
I think you could do that, but it is molded to
I mean,
the right
something
spaces,
is better than nothing.
The right spaces, right? Maybe there's a lot to that. I shouldn't take away from that.
I
We're
might
gonna-
not brush my teeth every day, so that'll help.
Can you hear Max on the microphones? Really? Cool. I want to leave all of this in. Like, this is great.
I just said I don't brush my teeth every day sometimes.
Well,
It's
that's
fine.
on you for outing yourself.
fine.
That's
but we're
why
all diving down the rabbit
That's
hole
why
here.
we're all going.
My
Maddie's
halitosis.
halitosis is wild today, isn't it? You
This
know?
I got so excited about this. I can't wait to. You're ordering me one, right?
Yeah.
Yeah. Okay. Amazing.
I can't.
All right. Pivoting.
Did you miss the whole Maddie halitosis?
He thought he was just maybe being nice because I'm going to get him a water pick.
Yeah.
Oh.
I gotta play my
Oral.
cards right here.
I'm taking advantage.
Last piece. What do you think about the connection between like poor sleep or snoring or sleep apnea and bad breath?
Oh my gosh, that's even more of a direct. So we know sleep apnea. Good question. Sleep apnea has a direct effect on your microbiome in your gut because oxygen diffuses. Well, number one, you get transient episodes of hypoxia that mess with your redox, and then eventually what it does is it leaks oxygen into the gut that causes loss of anaerobes. Well, same thing up here. With sleep apnea, what the question is, what does it change? Sleep apnea changes your saliva. They have lower saliva, lower lactoferrin production. They get dysbiosis.
You wake up in the morning with that dry mouth.
Yeah.
Like,
Yeah, exactly.
Yeah.
And to add to that, if you're using, do you have sleep apnea?
I was going to say he knew that dry mouth very well.
Maybe.
This is a rumor. I can neither confirm nor
That you
deny,
snore?
but I may be an open mouth sleeper.
Oh.
Yes.
Yeah, so open mouth sleeping. That gets
And you don't go to the dentist, double whammy.
that gets us to hostage tape. No, we won't talk about hostage
I can't
tape.
do it because I can't breathe through my nose.
See,
I end
yeah.
up suffocating. I tried it for like 3 days.
Oh, mouth breathing leads to, it's a lower saliva. It's a dehydration. It's you're changing your microbiome. So
You just turned 30 now, too. You're
so
fucked.
wow, that's an issue. Isn't it interesting how all these things have an influence and they lead to
The same thing.
same thing, and this loss of redox, this microbiome dysbiosis, and immune system dysregulation that can eventually lead to the problems with then infection, loss of bone from the cytokines, and oh my gosh, right? It's fascinating that this is the gatekeeper. Not that this is the gatekeeper. I don't know why you go. This is the gatekeeper that I don't think we pay enough attention to.
So how you were kind of saying with like the root canals and how they could lead to other things, were you saying more of though what has caused you to get to the point of needing the root canal?
Correct.
Could
Yes.
be what causes the other things,
Yes.
not the root canal itself.
Not the root canal itself. It's like, well, what leads to the root canal? Well, it's the steps that we just went through.
Can you repair things to make the root canal unnecessary?
I think yeah, absolutely. I think it's what every dentist tries to do, where you're hovering on where that nerve is just not sure which way it's going to go if you're in that state before the nerve kind of declares it's done, or you can give it that chance to survive and thrive by what? Improving the periodontal health of the mouth, and that's listening to them and starting to get your cleaning, get the biofilms removed when they do plaque removal. I mean, that's the first start of people have to get in and get that plaque removed. As much as it's a pain in the ass,
Yeah.
I'm sure you are doing good things for yourself. You're getting that biofilm removed to reduce the buildup of these pockets that build up these anaerobes, these gram-negative anaerobes that produce these LPSs and other metabolites that then influence the immune system and then affect redox, and then it's a cycle, and there you go. Your dental health is paramount to your systemic health.
Well, it was right before I had gotten sick. My tooth broke. And then when I got sick, I remember your sec, my mom, asked if there could be any correlation. But because I was sick, that broken tooth really fell to the back burner and I didn't care. But boy, when I tried to like clean it out, it exposed the nerve for sure. And it tasted so bad, but I was deathly afraid to go to the dentist. I don't know why. And when I finally went to the dentist, the smell that was coming from my mouth, from it just being dead, I was like, oh, I'm so sorry.
It was a buildup of all those. You were at a tipping point, and then it just got worse. But you were I think it just brings everybody back to, no matter what age, how important dental health is. And I can't emphasize it enough that it's something you can control and absolutely has an incredible influence on your systemic immune system, your systemic redox, and the microbiome of your gut, the microbiome of your lungs. I mean, gosh, I don't think we do enough due diligence in giving this the respect it needs to have. And so,
Performance protocol?
go to the dentist.
Well, I was going to say brush and floss, but yeah. Okay.
Yeah,
Water pick.
brush, floss,
And go to the dentist.
go to the dentist. I mean, use better products.
Speaking of using products, question. Because this is something Captain Peptide does a lot, and I mock him for it incessantly.
Whitening strips?
No. Mouthwash. Doesn't mouthwash just make it worse?
Okay, great question.
It's like an NAD similar, right?
So no. Mouthwash can remove some of these bad players with gum disease.
Yeah.
That it actually intermittently using mouthwash can be a good thing, but if you use it too much, you're going to wipe out your microbiome.
Yeah, he uses it like every day.
You can't do that on a daily basis. It's not probably a smart thing to do. It's
Yeah, you hear that, Cap?
on an intermittent basis, twice a week or something. I mean, I got to refer to my colleagues, my dentist, to give you maybe the professional approach to this, but I'm just giving you the redox thoughts here.
Yeah.
Interesting.
Mouthwash is one of those things that can be beneficial, but also can work against you if you use it chronically or long term or consistently. Because you don't want to wipe out your microbiome. You need your microbiome.
What about cycling? What if you use it once to twice a week for like a month or two, and then you don't use it for a couple months?
I think that's fine. I think that's absolutely fine. I think if you do if you do a good job of not letting plaque and biofilm build up and not letting these pockets of anaerobes grow in the gums, not getting any periodontal disease, you're not going to have any problems with breath or...
So you don't need the mouthwash.
So you don't need the mouthwash.
Yeah.
It's because your microbiome is in balance, your redox is in balance, and the epithelial cells there, and your immune system is functioning pretty well. You're not having protein catabolism and these issues of... And your lactoferrin, which is your natural antimicrobial that you want in your saliva, you're doing pretty good. So you don't need it.
Yeah, I'm being a little dramatic about it, but I've always made fun of him because in his checked bag he travels with like this industrial,
with the big one?
like a giant thing of Listerine. Oh yeah.
I have a question. So
This is a problem. We need an intervention, I think.
With
Captain Peptide. What about the patients who go to the dentist for their typical teeth cleaning? They're regular with it, but the one time they just end up with myocarditis from their tooth cleaning. How does that happen?
Well, that's the issue of where they're in a state of beginning, into the cleaning process where they're in such a bad periodontal disease that they have that leaking. They've lost the adhesions of the epithelial cells because they've lost the claudins, occludins, and the proteins that keep the epithelial cells tight. They've lost that due to the dysbiosis, loss of redox, and increased immune inflammation. And so those toxins and so forth can get to cause myocarditis because you're creating a trauma by cleaning up where they already may have a little bit of a beginning of the myocarditis, but not enough to build up.
Pushes them.
And it pushes it. Yeah. And it's a tough, that's a tough place. You just got to be aggressive, I think, there in realizing that's a harder place to be proactive, but you can if you realize that you have people that.
But what if it was someone who they go for their regular teeth cleanings and this one time it just so happened? Could it be from they destroyed their microbiome of their gums by using mouthwash every day? Could that?
That's a good question. I mean, theoretically, yeah. You can destroy your microbiome that then absolutely leads to dysbiosis, and then that creates the back channel of a redox problem and then an immune problem, and then that dysbiosis is already there. And so what's going to come back first are probably the more opportunistic bugs because you don't have the right, remember when the microbiome is in harmony, it's creating good things to keep everything, to manage everything. It's creating the right nutrients for the epithelial cells. It's creating the right environment acidically, pH-wise. It's creating the microenvironment for success. You're destroying that with the mouthwash every day. So could you create that scenario? Theoretically, absolutely.
Interesting.
I think that just about wraps up our conversation on bad breath.
Halitosis. Maddie's got a little halitosis.
For the record, I've never thought that your breath smells bad.
Yeah, me
thank
neither.
you. That's so nice.
I never.
Well, and I don't.
But
think
I try to stay far away.
It didn't I could just taste it because I would put my tongue in there just because I was obsessed with doing that, and I could taste the smell. And so then when they were actually drilling out the root canal, I could smell that taste. And I'm like, oh, I'm so sorry.
Yeah, because that got into that cytokine mix, that broth of bad stuff, really.
When I floss is when I smell that smell.
Interesting.
It's on the...
I don't know if
Well,
that's a
I
good
think
thing.
that's so. I think it's
No, not that. That's not like death smell. I just mean like a smelly smell that smells
I think this is a
Smelly.
wake-up call for everybody to get back into that, how important dental health is. And
Don't be afraid of the dentist. They're so sweet, and Novocaine works.
and
Jesus.
you got hygienists, you got awesome team, and I have to mention my team love crumble. You got to give them a little crumble, and you get along well.
I bet crumble is great for your teeth.
I know. It's like nothing like giving the dentist team sugar.
All right, we're starting to
I
crumble.
know, that's terrible.
We're starting to crumble. Let's read us out.
Yeah. So hey, guys, great episode. I think it has a lot of. It's a lot people can walk away with and do more research and again, I think get even more education from their dentists themselves. But great episode. Thank you for being with us on Redox Revolution. I can't wait to see you next week. Take care.
Brush your teeth.